Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. How often can we do a 3-day water fast? Before I get into this video, a little disclaimer. If you're going to do any type of fasting beyond a intermittent fasting or OMED, or 1 meal a day, I suggest you consult with your physician because we don't know your conditions and medications and so forth. So with that being said, let's get right into the video. So how often can you do this? When we have, let's say, a metabolic condition like type 2 diabetes or insulin resistance, right? Not quite diabetes, but you have some blood sugar dysregulation. If you do a 3-day fasting, you could improve insulin resistance, increase autophagy, and fat oxidation. So it can be quite beneficial for these types of patients. These patients can do it 1 to 2 times per month. And I would suggest setting a time frame. In this case, let's say 2 to 3 months. So you'll do 1 or 2 3-day fasts in a month for a duration of 2 to 3 months and see how impactful it will be on your health, okay? Obesity and weight loss resistance. It helps with lipolysis, decreases inflammation. With obesity, I would only recommend it once a month. And the reason is when you start to lose weight or rapidly lose weight and break down fat tissue, what can happen is you can create gallstones. So if you have a history of gallbladder stones, you want to be very cautious. So excess release of cholesterol into the bile is going to create gallstones for some individuals. So I would not recommend it more than once a month, okay? Or it has to be supervised. Next one is neurodegeneration, Alzheimer's, dementia, Parkinson's disease, etc. Helps to increase ketones and brain-derived neurotropic factors. So it's great for kind of cognitive degeneration, Alzheimer's, dementia, okay? 1 to 2 times a month. And I suggest being monitored for these patients, especially if they're not fully aware of what they're doing. And oftentimes with neurodegeneration, these patients are actually on multiple medications. They're a little bit older, they're on hypertensive medication, something to thin out the blood. So there are a lot of medications involved. So you want to be very cautious with a lot of different medications because we don't know the interactions there. With autoimmune disease, you can do 1 to 2 times a month. And again, you're going to set a time frame. You can do maybe 2 months of it and see what the impact is. The big thing with autoimmunity is when you fast, you reduce dietary proteins that can be inflammatory to our system. For example, let's say you have Hashimoto's thyroiditis, which is a thyroid condition that causes hypothyroid or low functioning thyroid. Oftentimes what we find in the office is that patients have gluten and allergy, dairy issues related to the Hashimoto's. So reducing those dietary proteins will help minimize the impact on the thyroid itself. Okay? So it decreases inflammation. Another thing about autoimmune disease is that a lot of people come in with multiple different autoimmune diseases. So when they have, let's say, a thyroid issue or Hashimoto's thyroiditis, the prevalence of or increased incidence of another autoimmune disease popping up goes up significantly. So oftentimes they'll have, let's say, rheumatoid arthritis, and then they have IBD or inflammatory bowel disease. So they have multiple things going on. Again, with multiple medications, you want to be cautious and speak to your provider about doing that. So as you can tell, most conditions you can do 1 to 2 times a month. What you need to do, though, is recover between the fasts. So you don't want to become nutrient deficient or malnourished, etc. You want to be able to feed yourself correctly in between the fasts and adopt a really healthy diet. Because if you don't adopt a healthy diet, what is the purpose of doing a 3-day water fast? If you go back to your old lifestyle, eating, junk food, McDonald's, sodas, whatever it is, okay? So adopting a healthy lifestyle is very important. I did make a full 3-day water fast video that was updated for 2025. So I'll link that in the video below, in the link below in the description. So you want to definitely watch that. Chronic pain and fibromyalgia, or ME, right? You want to probably do that once a month and test out the waters. You don't want to go into a full 3-day water fast for most people. You likely want to do, let's say, intermittent fasting, where you're eating within a 8-hour window and fasting for the other time period. Or you can do a 6-hour window of eating and then an 18-hour fast. So you want to gradually work up to doing a 3-day water fast, because you don't know how you're going to react, okay? So especially when you have fibromyalgia, you probably want to start with intermittent fasting and gradually become more protein and keto adaptive, and then maybe go into a 1-day fast, 2-day fast, 3-day fast. But potentially you can do that once a month. And the reason we say once a month is because when we have fibromyalgia, you don't want to become more nutrient deficient in any way. You want to definitely be cautious and slowly build up to it. Gut and digestive disorders, 1 to 2 times a month. It works phenomenally well with a lot of people who have issues with autoimmune conditions of the GI tract. Things like Crohn's or inflammatory bowel disease or colitis and so forth. 1 to 2 times a month is a fantastic time frame. Again, you want to do that for a short period of time, like 2 months or 3 months. You don't want to do it for extended periods. You need to figure out what's going to work best for you. If you have gastritis or burning, reflux, you want to be cautious, because as your stomach starts to empty out, you can get more reflux type symptoms. Okay, I do have a video on GI protocol, so I'll link that also in the description below. You definitely want to do gut healing protocols prior to doing anything if you have gastritis or burning, reflux type of symptomatology, okay? Because after 1 or 2 days, you're going to get more symptoms possibly. When you have chronic immune dysregulation or chronic infection, you can do that up to 2 times a month. It will increase autophagy, stem cells, and decrease inflammation. It's a great way, an adjunct. If you have chronic or what we call stealth infections, you do want to work with a provider who might be able to provide you with certain herbs and extracts that might help eradicate infection. Okay? General health. For most healthy individuals, you can probably do a fast every 3 to 4 months, or every quarter, really. You don't need to do a fast every month. I think a good healthy rate would be every 3 months or every 4 months for general health. Now, some disclaimers here. If you're pregnant or breastfeeding, you don't want to do a fast. Eating disorders, if you have problems with relationship with food, you got to be very careful. Those people who are malnourished. So there are actually people who have malabsorption syndrome. Those are the people who eat and they're still thin and skinny and gaunt. And those people are malnourished, usually because of digestive issues or malabsorption in the gut, and they're not getting their nutrients. So you've got to be cautious with those individuals. Type 1 diabetics who are on insulin, you got to be very careful. You definitely want to work with the provider. Severe adrenal dysregulation, because food will impact energy and how you feel and fatigue and so forth. So if you have a lot of stress and you have like true adrenal dysregulation, or what they call adrenal fatigue, you want to be very cautious. If you have a history of gallstones, you also want to be careful. Hypoglycemia or low blood sugar could be problematic for a lot of people. So these people, they need to do intermittent fasting and build up, become more protein and keto adaptive in order to do a fast. So these patients need to be very cautious and work up slowly to doing maybe even a OMED, or 1 meal a day, or a 1-day fast, okay? I mentioned before, gastritis, you got to be very careful with those individuals. Again, I'll link the full 3-day video, 3-day water fast video in the link below, or what they point up into this corner. I'll link the video in the corner there. All right, my name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.